Hello students, let's discuss what is pharmacy practice. Now everyone knows what is a pharmacy. So you can term pharmacy as a science of medicine which is associated with research, manufacturing, analysis, selling and distribution of the drugs. Now the main aim or the main goal of the pharmacy is to deliver effective and safe medications to the community. So this is the basic role of any pharmacy. Now coming to who is a pharmacist. Now everyone knows who is a pharmacist as this subject is included in the final year B.Pharm semester. All must be aware about who is a pharmacist. So if we see, a pharmacist is a qualified person who is either having a degree or a diploma. It should be a degree or it should be a diploma in B.Pharmacy. That is either D.Pharm or a B.Pharm. Second important thing is the registered pharmacist should be registered in the State Pharmacy Council. His name should be registered as a registered pharmacy in his State Pharmacy Council. Next one, he should have license as well as knowledge about sales, distribution and manufacturing of the medicines. Now coming to what is pharmacy practice. So it is the discipline of pharmacy which involves developing the professional roles of pharmacist. So basically it is a role of the pharmacist, how he can actually use his knowledge in order to serve the general public. A pharmacy practice offers practicing pharmacists in-depth useful reviews and research trials, as well as survey of new drugs, as well as novel therapeutic approaches. Now coming to good pharmacy practice requirements. What are the main or what are some pharmacy practice requirements? So first one, he should require that the pharmacist's first concern should be the welfare of patients in all the settings. The patient should be a priority for the pharmacist. Second important thing is the core of pharmacy activity is supply of medication as well as other healthcare products of assured quantity, then appropriate information and advice for the patient should be given, as well as monitoring the effects of their use. Now this is the main job of the pharmacist. Third important thing is the promotion of rational and economic prescribing along with appropriate medicine use. So all these things contribute to good pharmacy practice requirements. Now coming to what is the scope of pharmacy practice. So as we see now, the scenario of hospital pharmacy or the pharmacy practice in India is growing. So for successful practice of the hospital pharmacy, the students are required to learn various skills. What are the various skills which are required? Like the drug monitoring, okay, then the drug distribution, then TDM, which is known as therapeutic drug monitoring. Then they have to know some information about the drug as well as for the patient care. Next is advancement in research and technology. Then population exposure, like medical facilities if they are insufficient for all. And last is disease prevention and healthy promotion in the society. Now coming to the scope of pharmacy practice, meaning how this subject can help you all in your future, or what is the scope. So first is this can be used in community pharmacy. Next is it can be used in hospital pharmacy, clinical pharmacy, industrial pharmacy, nuclear pharmacy, pharmaceutical education, then journalism, government services, or even in clinical trials and information technology. Now, in community pharmacy, the students use various skills, like first is dispensing of drugs. Okay, dispensing means what? To give the drugs. Then responding to minor ailments by providing suitable, safe medication. Like whenever a person comes to your pharmacy and he comes up with some discomfort, you should be able to help that person. Okay. Next one is patient counseling for improved patient care. Counsel the patient, ask him about his medicines, ask him about his side effects, what all things are troubling him. So all those questions should be asked by the pharmacist, which is known as patient counseling. Now coming to the objectives, first is we should know various drug distribution methods which are being used in hospital, appreciate the pharmacy stores management and inventory control, monitor the drug therapy of patients through medication chart review and clinical review. Then you can obtain their medication history interview and you can counsel the patients. Identify the drug related problems, means if a person is taking a particular drug and after taking that particular drug they are facing some problems because of that drug, then you have to identify it. Detect and assess ADR. Now what is ADR? Adverse drug reaction, right? Then interpret selected laboratory results of the specific disease. Know the pharmaceutical care services, do the patient counseling, and appreciate the concept of rational drug therapy. Now, this is very important. What is rational drug therapy? Only those drugs are to be given which are actually needed by the patient. That is something known as rational. So, basically, in simple terms, you can say that safe use of the drugs. So with this, I conclude this topic. If you all are having any doubts, let me know in the comment section. Thank you.